As a brain doctor, I've spent years studying what helps and what harms the aging brain. But one recent discovery left even me stunned. It wasn't a new medication or a rare disease. It was a sleeping position. Yes, something as routine as the way you lay your head on the pillow each night could silently raise your risk of stroke, especially if you're over 60. Each night, millions of seniors fall asleep believing they're getting the rest their body needs, unaware that a dangerous position might be quietly restricting blood flow, increasing brain pressure, and making them more vulnerable to a stroke overnight. And it's not just a theory. I've seen it happen. Patients admitted with sudden strokes, no warning signs, no family history, only for us to uncover that poor sleep posture played a major role in their brain's crisis. The position they had trusted for decades was working against them. Most people don't realize that during sleep, the brain undergoes critical maintenance. Blood vessels relax, cerebrospinal fluid drains toxins, and oxygen delivery becomes even more important. But all of that depends on one key thing: unblocked, healthy circulation. And that's exactly what certain sleeping positions may disrupt. In this video, I'm going to walk you through the science, the risks, and the solution. I'll reveal the one sleeping position that brain experts now strongly warn against, and show you safer ways to sleep that could help protect your brain from harm. If you or someone you love is over 60, you can't afford to miss this. The position you sleep in tonight could change everything by morning. Let's uncover the truth, before it's too late. After the age of 60, the risk of stroke rises significantly, and it's not by chance. As the body ages, so does the entire vascular system. Arteries that once carried blood efficiently to the brain can become stiff, narrow, or even blocked by plaque. Blood pressure often rises, heart rhythms become irregular, and tiny clots form more easily. These changes, while gradual, create the perfect storm for stroke, especially if the brain's blood flow is disturbed during something as routine as sleep. A stroke occurs when blood flow to part of the brain is interrupted, either due to a clot blocking a vessel or a vessel bursting. Within minutes, brain cells begin to die. It's fast. It's silent. And it's one of the leading causes of long-term disability and death in people over 60. In fact, according to global health data, nearly 75% of all strokes occur in individuals aged 65 or older. That's not just a number, it's a wake-up call. But why does stroke become so much more dangerous after 60? The answer lies in vulnerability. As we age, our brains become less resilient to damage. Recovery is slower. Nerve pathways don't regenerate as efficiently. The immune response is weaker. What might be a minor event in a younger person can become catastrophic for a senior. And here's the deeper issue: strokes don't always start with warning signs. For many seniors, the first symptom is the stroke itself. One day everything is normal. The next, you or your loved one may wake up with slurred speech, facial drooping, confusion, or worse, unable to move or speak. That's why prevention is not optional, it's critical. Every risk factor matters. High blood pressure, diabetes, cholesterol, atrial fibrillation, sleep apnea, and smoking all compound over time. But one of the most overlooked factors is the role of sleep, not just its quality, but how you physically position yourself while sleeping. After 60, the body's ability to regulate blood pressure during the night becomes less effective. Certain sleeping positions can actually contribute to blood stagnation, increased intracranial pressure, or even temporary airway obstruction, all of which can compromise brain function and circulation. This is especially true for people who already have narrowing arteries or previous silent strokes. If your brain is already relying on limited blood supply, even a subtle disruption, caused by poor sleep posture, can tip the balance. A slight tilt of the neck, prolonged pressure on one side, or reduced oxygen flow can be enough to provoke an event. The reason this matters so much is because stroke is not just a medical emergency, it's a life-changing event. For seniors, surviving a stroke often means facing major rehabilitation, permanent disability, loss of independence, or cognitive decline. Tasks as simple as brushing teeth, walking to the kitchen, or recognizing family members may no longer be possible. But it doesn't have to be that way. Stroke is largely preventable. By understanding your risk, monitoring your health, and making simple changes, like adjusting the way you sleep, you can dramatically reduce your chances of experiencing one. Especially after 60, prevention starts at home, in the quiet hours of the night, when you think your body is resting, but your brain might be fighting to stay alive. So while sleep should be the time your brain restores itself, it can also become a hidden danger if you're not careful. That's why stroke risk after 60 should never be taken lightly. Because once damage is done to the brain, there's no going back. Awareness, especially of silent risk factors like sleep position, is your first and best line of defense. When you fall asleep, your body shifts into a restorative state. Heart rate slows, breathing deepens, and brain activity enters various cycles designed to repair, reset, and rejuvenate both mind and body. But while this seems peaceful on the surface, there's a complex and delicate balance happening beneath. One of the most critical systems in play during sleep is cerebral circulation, the flow of oxygen-rich blood to your brain. The brain, despite weighing only about 2% of your body weight, consumes roughly 20% of your body's oxygen supply. This oxygen is delivered through a dense network of blood vessels, arteries, veins, and capillaries that must remain open and free-flowing at all times. When you're awake and upright, gravity helps this circulation system work efficiently. But once you lie down, especially in certain positions, circulation patterns change. In seniors, these changes become even more significant. Arteries may have hardened over time, a condition known as atherosclerosis, causing blood flow to become sluggish. If the head or neck is positioned in a way that compresses blood vessels, the impact is far greater on an older adult than on someone younger. Even a minor restriction of blood flow for several hours can cause enough stress on the brain to trigger complications, especially if combined with other pre-existing issues like high blood pressure or atrial fibrillation. Pressure is another key factor. When you lie flat, particularly on your back or stomach, intracranial pressure can increase. That's the pressure inside your skull, including the brain tissue and cerebrospinal fluid. Normally, this pressure is balanced and harmless. But in aging brains, especially those already dealing with reduced drainage or venous insufficiency, even slight elevations in pressure can reduce cerebral perfusion, the brain's ability to receive fresh blood. Think of the brain like a sponge. It soaks up nutrients and oxygen during sleep, while pushing out waste and toxins through the glymphatic system, a brain-wide drainage network that becomes most active during deep sleep. But for this detox system to work efficiently, the brain must be well perfused and pressure-free. If the neck is kinked, if one carotid artery is compressed, or if venous return is slowed because of how you're sleeping, that cleansing cycle gets disrupted. Waste builds up, and inflammation slowly increases. Over time, this may contribute not just to stroke, but to cognitive decline, memory loss, and even conditions like vascular dementia. Another critical factor is oxygenation. During sleep, especially in deep REM stages, breathing patterns shift. For seniors with undiagnosed sleep apnea, obesity, or even mild snoring, oxygen levels can dip lower than they should. If this happens while lying in a position that further narrows airways, like stomach sleeping with your head turned sharply to one side, then oxygen deprivation becomes a double threat. Not only is blood supply to the brain reduced, but the oxygen content of that blood is also lower. That combination significantly increases stroke risk. There's also something called nocturnal blood pressure dipping, which is supposed to be a healthy phenomenon where blood pressure drops slightly during restful sleep. But in many seniors, especially those with poorly controlled hypertension or autonomic dysfunction, this dip becomes either exaggerated or reversed. That means the blood pressure can spike instead of drop at night, placing sudden stress on weakened blood vessels in the brain. If someone is lying in a position that already increases intracranial pressure or slows blood flow, the added spike in blood pressure can rupture a vessel or dislodge a clot. What makes all this more dangerous is the fact that you're asleep. You don't feel the pressure building, the arteries narrowing, or the oxygen dropping. There's no warning, no discomfort. Your body might be fighting for stable circulation while you drift deeper into unconsciousness. And when a stroke occurs during sleep, as it often does, it may not be noticed for hours. This delay in treatment can be devastating. Every minute during a stroke, millions of brain cells die. That's why time is brain, and why prevention is everything. Age compounds all of this. By 60 and beyond, the vascular system has already experienced decades of wear and tear. Veins may no longer drain as efficiently. Baroreceptors, the sensors that regulate blood pressure, become less responsive. The brain's demand for oxygen and glucose doesn't decline, but its ability to recover from an insult does. This means that even small reductions in blood flow caused by poor sleep posture may result in permanent damage. One more overlooked element is neck position. The carotid arteries, which run along each side of the neck, are major highways of blood to the brain. Certain sleep positions, especially those involving extreme neck rotation or compression, can partially block these arteries for extended periods. In healthy young people, this might not cause any immediate harm. But in older adults, especially those with known narrowing or plaques, this can reduce cerebral blood flow enough to cause tissue ischemia, the first stage of a stroke. The vertebral arteries, which pass through the spine and feed the brainstem, are also vulnerable. Sleeping in a twisted or compressed position can obstruct these as well, especially in people with arthritis, spinal degeneration, or disc issues common in seniors. It's important to realize that the body doesn't shut down during sleep. In fact, some of its most critical processes, brain detox, memory consolidation, tissue repair, hormone regulation, take place at night. And all of them depend on the smooth, uninterrupted flow of blood and oxygen to the brain. This is why sleeping position matters. It's not just about comfort or avoiding a stiff neck. It's about protecting the most delicate, most vital organ in your body from silent, accumulating damage. If your sleeping posture is interfering with circulation, compressing your arteries, or lowering oxygen delivery, it could slowly, and silently, be setting the stage for a catastrophic event. What's alarming is that so few people know this. Sleep is often viewed as passive, but it's anything but. For seniors especially, it's one of the most biologically active and vulnerable times of day. And unless your sleeping position supports healthy blood flow and optimal oxygenation, you might be spending a third of your life putting your brain at risk. So while you sleep to recharge your body, you need to make sure your brain is being cared for too. Because the way you position yourself during those 7 or 8 hours can either support your brain's health, or slowly undermine it, night after night. When it comes to sleep, most people assume that the position they're used to is the one that's best for them. It's habit, comfort, routine. But in reality, the way you position your body at night, especially as you age, can have a dramatic effect on your circulation, breathing, spinal alignment, and, most importantly, your brain's access to oxygen and blood flow. Let's start with the most common sleep position, side sleeping. This is the most popular sleep posture across all age groups, and for good reason. Side sleeping can promote better spinal alignment, reduce snoring, and improve circulation in certain parts of the body. For seniors, especially those with sleep apnea, arthritis, or acid reflux, side sleeping is often recommended. But even this position isn't foolproof. The side you sleep on makes a big difference. Sleeping on the right side has been shown to reduce pressure on the heart and may improve heart rate variability. However, some studies suggest that sleeping on the left side may promote better lymphatic drainage from the brain, enhancing the brain's ability to flush out toxins during sleep through the lymphatic system. This detoxification process is particularly important for aging brains, as the buildup of waste proteins has been linked to cognitive decline and diseases like Alzheimer's. That said, side sleeping also comes with risks, especially if done improperly. Curling into a tight fetal position can constrict the diaphragm and reduce lung capacity, limiting oxygen intake. Resting the head on a thick pillow can tilt the neck sharply, compressing arteries and veins that carry blood to and from the brain. Over time, if one side of the neck is constantly under pressure, this can lead to vascular imbalances and even promote the formation of blood clots in predisposed individuals. Next is back sleeping. On paper, it sounds like the ideal position. Lying flat on your back with your head in a neutral position can support the spine, reduce joint stress, and evenly distribute body weight. For younger people without any medical issues, back sleeping can actually be one of the healthiest options. But for seniors, the story is different. Back sleeping can significantly increase the risk of airway obstruction, particularly in individuals with sleep apnea or reduced muscle tone in the throat. As we age, the muscles that keep the airway open during sleep become weaker. When lying on your back, the tongue and soft palate can fall backward, partially or completely blocking the airway. This leads to pauses in breathing, called apneas, which in turn cause dips in oxygen levels throughout the night. These apneic episodes place enormous strain on the cardiovascular system. Each time the body senses a lack of oxygen, it triggers a stress response, heart rate increases, blood pressure spikes, and the brain is jolted into a lighter sleep stage or even partial awakening. Over time, this constant stress disrupts the deep, restorative phases of sleep and contributes to inflammation, high blood pressure, arrhythmias, and, yes, stroke risk. Furthermore, lying flat can increase intracranial pressure in certain individuals. Seniors with a history of hydrocephalus, previous strokes, or poor venous drainage may be especially vulnerable to the effects of elevated brain pressure during back sleeping. The pressure may be subtle and undetectable at first, but over weeks, months, or years, it can reduce cerebral perfusion and accelerate neurodegenerative changes. Then we have the most problematic position of all, stomach sleeping. While some people claim it helps with snoring or improves comfort, it is widely regarded as the most physiologically stressful sleep posture, especially for older adults. When you sleep on your stomach, your spine is forced into unnatural alignment. Your neck is twisted sharply to one side for hours, compressing the carotid and vertebral arteries and placing constant strain on the cervical spine. This position not only impedes blood flow to the brain, but also compromises the airway. Breathing becomes shallow and restricted, and in some cases, partially obstructed. Oxygen levels can drop, and the chest has less room to expand. For seniors with decreased respiratory efficiency, this can lead to periods of low oxygen saturation throughout the night, another major stroke risk. Stomach sleeping also increases pressure on the abdomen, which in turn can affect circulation in the lower body. Blood return from the legs to the heart becomes less efficient. Combine that with reduced oxygen intake and restricted neck vessels, and you have a triple threat: reduced cerebral circulation, poor oxygen delivery, and mechanical stress on the nervous system. One of the most overlooked aspects of stomach sleeping is the asymmetrical pressure it places on the head and neck. Sleeping with the head turned to one side night after night can contribute to asymmetrical vertebral artery compression, leading to long-term imbalances in blood flow to the brainstem. While this might not cause immediate symptoms, over time it can contribute to dizziness, balance issues, cognitive changes, or transient ischemic attacks, mini-strokes that are often precursors to major strokes. Seniors are particularly susceptible to these effects because of natural degenerative changes in the cervical spine, narrowing of arteries, and increased fragility of the blood vessels. What might be tolerable for a younger person could become dangerous for someone over 60. In clinical practice, we've seen patients who suffered strokes overnight and, upon investigation, had no clear cause other than long-standing vascular risk and poor sleeping posture. These cases often involve people who consistently slept on their stomach or with their neck hyperextended. While it may seem like a small factor, posture during sleep can compound other risks in dangerous ways. It's important to understand that sleeping position doesn't work in isolation. It interacts with everything else: your blood pressure, your heart rhythm, your oxygen levels, your spine, your airway. One vulnerable system can set off a chain reaction. And in a brain already dealing with reduced resilience due to age, the consequences can be permanent. The reality is, sleeping posture is often overlooked because it feels natural. We choose the position we've always used, not realizing our body has changed with age. Joints have stiffened, tissues are less elastic, blood vessels more fragile. That's why the sleep posture that worked in your 30s may not be safe in your 60s or 70s. Changing sleep position isn't always easy, especially after decades of habit. But awareness is the first step. When you understand how different positions affect your circulation, your breathing, and your brain health, you can start making adjustments. Whether it's using the right pillow, elevating your head slightly, or training your body to sleep in a safer posture, these changes can make a huge difference. What's most important is consistency. Sleeping safely one night and poorly the next doesn't protect your brain. Night after night, the pressure builds, or the healing happens. And for seniors, every night is a critical window of protection or risk. The position you choose could determine the health of your brain for years to come. The sleeping position that raises the most concern among brain health professionals, especially for people over 60, is stomach sleeping. It might come as a surprise, especially if it's been your go-to position for decades. But stomach sleeping combines several physiological risks that, together, make it one of the most dangerous sleep postures for stroke-prone seniors. To understand why, let's break down what actually happens to your body, and more specifically, your brain, when you sleep on your stomach. First, take the neck. In order to breathe while lying face down, your head must be turned sharply to one side, often for several hours at a time. This unnatural rotation places stress on the cervical spine and compresses the blood vessels that run along the neck, especially the carotid and vertebral arteries. These arteries are responsible for delivering oxygen-rich blood to the brain, and when they're partially compressed for extended periods, blood flow to the brain can decrease. The reduction in blood flow might be small, even undetectable in the moment. You won't feel pain. You won't wake up gasping. But over time, this decreased perfusion, especially in combination with other vascular issues like atherosclerosis or blood clotting disorders, can slowly deprive brain cells of oxygen. In worst-case scenarios, it can lead to what doctors call ischemic events, or strokes. Even more concerning is what happens when these arteries already have minor blockages or plaques, which is common in older adults. The twisting of the neck during stomach sleeping can create turbulent blood flow in areas where it should be smooth. This turbulence increases the chance that a clot or piece of plaque could break off and travel to the brain, where it might block a smaller artery and cause a stroke. Then there's the issue of intracranial pressure. When you lie flat on your stomach, especially on a soft mattress, your head often sinks lower than your spine. This can cause a downward shift of blood and cerebrospinal fluid toward the brain, increasing pressure inside the skull. For seniors with pre-existing venous drainage issues, this is dangerous. It reduces the brain's ability to flush out toxins, raises inflammation, and contributes to slower blood circulation through sensitive brain tissue. Stomach sleeping also directly affects breathing. Lying face down compresses the chest and abdomen, making it harder for the lungs to expand fully. For seniors, who already experience reduced lung elasticity and weakened respiratory muscles, this means less oxygen is entering the bloodstream. The body responds by increasing heart rate and blood pressure, both of which place extra stress on the vascular system. If oxygen levels drop too low, and blood pressure spikes too high, the chances of a stroke rise significantly. Let's not forget airway obstruction. Many seniors suffer from undiagnosed or untreated sleep apnea. This condition causes the upper airway to collapse repeatedly during sleep, leading to brief interruptions in breathing. Sleeping on your stomach may seem like it helps prevent snoring, but it actually narrows the airway even more in many cases. The result? Repeated episodes of low oxygen saturation and surges in blood pressure throughout the night. Over time, this severely damages the delicate blood vessels in the brain and heart. What's even more troubling is that stomach sleeping also promotes asymmetrical pressure. One side of your face is pressed into the pillow. One side of your neck is stretched and rotated. This creates a one-sided burden on your circulatory and muscular systems. The carotid artery on that compressed side is under stress for hours. For someone with even mild carotid artery narrowing, a common condition in seniors, this can reduce blood flow enough to create ischemic zones in the brain. There's also evidence that certain individuals experience what's known as vertebrobasilar insufficiency when the neck is turned sharply. This means the vertebral arteries, which supply blood to the back of the brain and brainstem, are compromised by the neck rotation. These arteries run through the cervical vertebrae, and turning your head sharply in one direction can pinch them, especially if you already have degenerative disc disease, osteoarthritis, or spinal misalignment, all common in older adults. The brainstem controls critical functions like breathing, heartbeat regulation, and blood pressure. If blood flow to this area is even temporarily reduced, the results can be catastrophic, ranging from dizziness and blackouts to full-blown strokes. But why do so many people choose this position in the first place? Often, it starts in youth. Stomach sleeping may feel comforting, especially for those dealing with anxiety or stress. The pressure on the body can be calming. Some say it helps them fall asleep faster. But what feels good doesn't always mean it's safe, especially decades later when the body changes. The long-term effects of stomach sleeping usually don't appear until later in life, when the body becomes less resilient. By the time someone reaches their 60s or 70s, the damage may already be underway: reduced circulation, compressed arteries, diminished lung capacity, and stomach sleeping only accelerates the decline. Clinical evidence supports these concerns. In studies of stroke patients, researchers have identified patterns where those who suffered strokes during sleep were more likely to have been sleeping on their stomachs. While correlation doesn't always equal causation, the consistency of these findings has alarmed many in the neurology and sleep medicine communities. A growing number of neurologists and sleep specialists are now advising older adults to avoid stomach sleeping altogether. It's not just about improving sleep quality, it's about preserving brain health and reducing the silent risks that build over time. The recommendation is clear: after age 60, the body's vulnerabilities demand smarter, safer sleep habits. And stomach sleeping is simply too risky to continue. Of course, changing sleep positions isn't always easy. The body has muscle memory. You may find yourself rolling back into the stomach position without realizing it. But there are tools that can help: specialized pillows, body positioning supports, and even sleep shirts that prevent you from turning onto your stomach. With time, your body can adapt to a safer position, and the benefits will be well worth the effort. The most important takeaway is this: stomach sleeping places unnecessary stress on the brain's blood supply, oxygenation, and pressure regulation, especially in seniors. If you're over 60, or caring for someone who is, recognizing this one factor could be the key to preventing a silent, overnight stroke. Changing this one habit may not feel urgent. But for your brain, It could mean the difference between a healthy tomorrow and a life-changing event you never saw coming. Don't wait for symptoms. Don't wait for warning signs. Make the change now, and protect the brain you've spent a lifetime building. It's one thing to hear a doctor warn against a sleeping position. It's another to have science back it up. Over the last decade, the connection between sleep posture and stroke risk has moved from theory into evidence-based discussion, with more researchers and neurologists shedding light on this once overlooked factor in senior health. One of the most compelling pieces of evidence comes from a large-scale study published in the journal Neurology, which analyzed overnight strokes that occur while the person is sleeping. Researchers found that a significant number of these patients had no known warning signs and were discovered unconscious or impaired in the morning. What stood out was that many of these patients had been sleeping on their stomach or with their necks rotated sharply at the time the stroke occurred. The researchers couldn't ignore the pattern. The idea that head and neck position can influence stroke risk has been further supported by work done on vertebral artery compression. In a groundbreaking study conducted at a European spine clinic, MRI imaging revealed that extreme head rotation, such as what occurs during stomach sleeping, can lead to significant narrowing of the vertebral arteries, especially in elderly patients with degenerative changes in the spine. The more rotated the neck, the greater the reduction in blood flow. In some cases, this flow dropped by as much as 60%. Another study from the Journal of Stroke and Cerebrovascular Diseases highlighted the risks of asymmetric sleep positions in patients with carotid artery stenosis, a condition where the carotid arteries, which deliver blood to the brain, are partially blocked. The study showed that sleeping on the side of the blocked artery significantly reduced blood supply to the affected hemisphere of the brain during sleep. This reduction, although temporary, was enough to trigger what the researchers called sleep-related transient ischemic attacks, mini-strokes that often precede major ones. Sleep medicine specialists have long warned about the impact of sleep apnea on cardiovascular health, but only recently have they begun focusing on sleep posture as a contributing factor. Dr. Rina Mehra, a leading sleep researcher at the Cleveland Clinic, stated in a symposium, "For older adults, the combination of obstructive sleep apnea and poor sleep posture may amplify stroke risk far beyond what we previously thought." Airway positioning, neck alignment, and circulation are intimately connected. They must be addressed together, not separately. Further backing comes from autopsy reports. In a 5-year retrospective analysis at a major stroke unit in Tokyo, researchers found that over 40% of patients who died from large ischemic strokes had pre-existing vertebral or carotid artery narrowing, and had reported, or been observed, to be regular stomach sleepers. The authors proposed that repetitive nocturnal compression of the arteries may have weakened vessel walls and triggered plaque rupture, leading to embolic events. These findings are reinforced by case studies in neurology journals. One notable case involved a 68-year-old woman with no prior history of heart disease or stroke. She was found unresponsive in bed, and imaging showed a massive brainstem stroke. After ruling out common causes like atrial fibrillation or severe hypertension, investigators turned to sleep posture. Family members confirmed she slept face down, with her head twisted sharply to the right every night for years. MRI angiography later showed vertebral artery narrowing at the exact location of neck compression. The medical team concluded that her sleep posture was the likely precipitating factor. Functional MRI studies have also demonstrated how blood flow to the brain changes with body position. When subjects lie flat on their stomachs with the neck rotated, perfusion maps show decreased blood delivery to certain areas of the brain, especially the occipital lobe and cerebellum, regions supplied by the vertebral arteries. These same regions are vulnerable to ischemia and are often affected in sleep-related stroke cases. From a brain doctor's perspective, all of this makes clinical sense. Dr. Michael DeGiorgia, a neurointensivist at Case Western Reserve University, has seen firsthand the aftermath of strokes that occur during sleep. In an interview, he said, "One of the most frustrating things about overnight strokes is that they're often irreversible by the time the patient is found. By then, the damage is done. That's why prevention is so critical, especially with modifiable risk factors like sleep posture. He goes on to explain that as people age, their resilience to temporary reductions in blood flow diminishes. The young brain can tolerate a few minutes of reduced perfusion and bounce back. The aging brain? Not so much. Even short episodes of low blood flow during sleep, repeated night after night, can have cumulative effects. It's like slow-motion brain injury. Another expert voice in this field is Dr. Helene Mselam, director of the Center for Sleep and Wake Disorders. She emphasizes the importance of spinal alignment and airway patency during sleep, especially for older adults. As we age, we lose the muscular tone that keeps our airway open and our blood vessels protected. If you're sleeping in a position that collapses your airway or compresses a vital artery, you're asking for trouble. So why isn't this more widely discussed? Part of the reason is habit. Sleep posture is such a personal and long-standing behavior that most people never question it. Doctors often focus on diet, medication, and exercise but rarely ask, how do you sleep? Yet it's one of the few risk factors that's 100% in your control. You can't change your age. You can't erase your genetics. But you can absolutely adjust how you position your body at night. Some neurologists are now advocating for what they call sleep ergonomics, a new approach to sleep health that includes posture training, positioning tools, and even pillows designed to support healthy circulation and spinal alignment. The goal is not just to improve comfort but to prevent the kind of nighttime brain events that go unnoticed until it's too late. There's also growing awareness in the world of stroke rehabilitation. Physical therapists and sleep specialists working with stroke survivors often discover that unsafe sleep positions were part of the patient's routine before the event. This leads to new protocols in stroke recovery units, where positioning during naps and nighttime rest becomes part of the treatment plan to prevent recurrence. Even smart wearable technology is catching up. Some sleep trackers now monitor body position, oxygen levels, and movement patterns throughout the night. While still in their early stages, these tools are starting to help clinicians and users identify harmful sleep habits before they cause permanent damage. Every doctor involved in stroke care will tell you the same thing: prevention is the most powerful tool we have. And in the world of sleep, that means understanding the way your body behaves during those critical hours when you're not conscious enough to notice small things, like how your neck is twisted, or how your airway might be partially closed, or how blood flow to your brain might be compromised. It's time we move beyond the outdated idea that sleep posture is just about comfort. It's about protection, longevity, and ultimately, survival. Sleep is more than just rest, it's one of the most active, restorative periods for the brain, especially in people over 60. During sleep, your body isn't shutting down. It's engaging in critical processes that determine how sharp your memory is, how well your blood circulates, and how effectively your brain flushes out dangerous toxins. When you sleep in the wrong position, those processes are disrupted, and that disruption can quietly increase your risk of stroke overnight. One of the brain's most fascinating functions during sleep is its self-cleaning process. This process is managed by something called the glymphatic system, which acts like a waste disposal unit. Throughout the day, as your brain cells work, they produce waste, proteins like beta-amyloid and tau, both of which are linked to Alzheimer's and other neurodegenerative diseases. These waste products build up silently unless they're cleared out efficiently. And when does the brain do this cleaning? Almost exclusively during deep sleep. Now, here's the key: researchers have found that certain sleep positions directly influence how well this cleaning process works. In one study published in the Journal of Neuroscience, scientists discovered that side sleeping, particularly on the left side, promotes better glymphatic flow compared to sleeping on the back or stomach. Stomach sleeping, in particular, was associated with restricted fluid movement, which could reduce the brain's ability to detoxify itself at night. That means more waste buildup, more inflammation, and more long-term risk for stroke and brain degeneration. But detox isn't the only concern. Let's talk about blood pressure, a key player in stroke risk. During healthy sleep, your blood pressure naturally dips, giving your heart and arteries a chance to rest. This nightly dip, called nocturnal dipping, is so important that doctors use it as a marker for cardiovascular health. If your blood pressure doesn't drop enough while you sleep, your risk of stroke and heart disease goes up dramatically. Unfortunately, the wrong sleep position can interfere with this critical process. Sleeping in positions that compress your abdomen or twist your neck, like lying flat on your stomach, can stimulate the sympathetic nervous system. This causes your body to enter a stress-like state, keeping your blood pressure elevated when it should be going down. Over time, this loss of restorative blood pressure dipping damages blood vessels and puts enormous strain on your brain's delicate capillaries. Worse still, if you're already on medications for hypertension, a common scenario for seniors, sleeping the wrong way might counteract their effects. Even though you're taking your pills faithfully, you may be unintentionally undoing the benefits by sleeping in a position that keeps your body in a state of tension or blood flow restriction. And we can't forget oxygenation. Your brain needs a constant, rich supply of oxygen to function properly. Even brief periods of reduced oxygen during sleep, such as what happens in sleep apnea, can damage brain tissue and trigger silent strokes. But here's what many people don't realize: your sleeping position plays a major role in how well you breathe at night. When you lie on your stomach, your chest is compressed and your airway is more likely to become partially restricted. This isn't just uncomfortable, it can lead to subtle drops in oxygen levels that you may never notice. But your brain does. Over time, these nightly episodes of low oxygen, what doctors call nocturnal hypoxia, can injure the small vessels that supply your brain, making a future stroke far more likely. Sleep studies have repeatedly shown that people who sleep in improper positions are more likely to experience microarousals, moments when your brain briefly wakes up due to poor oxygen or elevated pressure in the neck or chest. These arousals interrupt your sleep cycle and prevent you from reaching the deep stages of sleep needed for brain repair, memory consolidation, and emotional balance. If your brain doesn't reach deep sleep, it can't fully repair itself. It can't clear waste. It can't regulate blood pressure. And it can't protect itself from the slow, steady wear and tear that leads to strokes, dementia, and cognitive decline. This is why something as small as your sleep posture carries such huge consequences over time. Another concern tied to oxygenation is snoring. While many people laugh off snoring as a harmless annoyance, it's often a red flag. Loud, habitual snoring, especially in a stomach sleeper, may indicate upper airway resistance or partial obstruction. That means your brain may be experiencing frequent dips in oxygen all night long. Over months and years, this damages the endothelial lining of your blood vessels, promotes plaque buildup, and increases the chance of a clot forming or a vessel rupturing. For seniors who already have narrowing in the carotid or vertebral arteries, common with age, this is a recipe for disaster. You may go to bed feeling fine, unaware that your sleep position is amplifying every risk factor quietly, night after night. Then, one morning, you wake up unable to speak, move, or think clearly. The damage has been done, and often, it's irreversible. Even those without diagnosed sleep disorders aren't in the clear. As we age, our tissues become softer, muscles lose tone, and the position of the tongue and jaw can shift more easily into an obstructive posture. That's why even seniors who never had sleep apnea before may develop mild forms later in life, and sleeping in positions that further reduce airway openness only worsens the problem. There's one more factor worth noting: cerebrospinal fluid pressure. In certain positions, especially stomach sleeping, the angle of the neck can increase pressure inside the skull. This may contribute to small vessel compression, impaired drainage, and swelling in the tissues surrounding the brain. While this effect isn't always dramatic, in older adults with fragile vessels, it can be enough to push the brain toward a crisis point. All of this paints a sobering picture. Sleep isn't just recovery time, it's a high-stakes health process where your brain, blood vessels, heart, and lungs must all work together in perfect harmony. And when one element, like your posture, is off, it throws the whole system into imbalance. Over time, that imbalance can lead to tragedy. Yet, there's hope. Once you understand how these systems work together, and how your sleep position affects them, you gain power. You can take control. You can make adjustments that help restore healthy circulation, oxygenation, and detoxification. That's not just good for preventing stroke, it's good for memory, mood, longevity, and overall brain health. So while it may sound overly simple to say, just change how you sleep, the science says otherwise. The position you choose tonight could very well shape the health of your brain tomorrow. Most people never think twice about how they sleep. They choose the position that feels most comfortable or that they've been used to for decades. But comfort doesn't always equal safety, especially as we age. Among all the ways to sleep, there is one position that quietly increases the risk of stroke more than others, especially in people over 60. That position is sleeping on your stomach. At first glance, it might seem harmless. Many stomach sleepers say it helps them fall asleep faster or that it prevents snoring. But under the surface, stomach sleeping triggers a chain of harmful effects that can slowly damage the brain, the heart, and the fragile blood vessels in between. When you lie on your stomach, your head is turned sharply to one side, usually at an awkward angle for hours at a time. This twist compresses the vertebral arteries in the neck, reducing blood flow to the brain. These arteries are small but critical. They supply oxygen-rich blood to the brainstem and cerebellum, which control balance, coordination, and basic survival functions. As the neck stays twisted for long periods, the muscles stiffen and the arteries can narrow temporarily, like squeezing a garden hose. In a young, healthy body, this might not cause any immediate harm. But for seniors, especially those with stiff arteries or plaque buildup, this compression can dramatically increase the risk of a transient ischemic attack, or worse, a full-blown stroke. But that's not all. Stomach sleeping also places pressure on the chest and abdomen, restricting natural breathing movement. As your lungs have less room to expand, your oxygen intake is reduced. This lower oxygen level doesn't always wake you up, but it does signal the brain that something is wrong. Over time, this nightly pattern of low-grade oxygen deprivation creates inflammation, weakens blood vessels, and contributes to the kind of silent damage that often leads to strokes during sleep. If you're a stomach sleeper, think about how your arms and shoulders are positioned. Most people sleep with one or both arms under the pillow or stretched upward. This can compress nerves and blood vessels, not only in the arms but in the shoulder girdle and even in the neck. The brachial plexus, a nerve bundle that helps control the arms and hands, can become compressed during prolonged stomach sleeping, leading to tingling, numbness, and even long-term nerve damage. The tension in this position doesn't just stay in the upper body, it radiates through the spine, placing stress on the lower back and even shifting pelvic alignment over time. And let's not forget the impact on sleep quality itself. Many stomach sleepers wake up several times throughout the night, even if they don't remember it. These micro-awakenings interrupt the sleep cycle, preventing the brain from entering deep, restorative stages of rest. Without reaching these stages, the brain cannot detoxify properly, regulate emotions, repair neurons, or balance hormones, all of which are crucial for senior health and stroke prevention. In fact, recent studies using sleep lab imaging and MRI scans have shown that stomach sleepers tend to have higher levels of residual brain inflammation in the morning compared to those who sleep on their sides or backs. This inflammation, over months and years, becomes a silent contributor to stroke risk. Your brain doesn't need a single dramatic event to begin declining. Slow, repeated damage adds up. It's also important to consider the effect of gravity. When lying on your stomach, gravity can cause your tongue and soft tissues to fall forward and press against your airway. This doesn't just increase snoring, it can also cause partial airway collapse, again lowering oxygen levels throughout the night. In older adults whose airway muscles are already less toned, this effect is amplified. And since oxygen is the most critical element the brain needs to survive, even short episodes of deprivation can push vulnerable tissues closer to injury or stroke. Stomach sleeping can also cause what's called positional hypoxia. This is a condition in which certain body positions create partial obstruction of breathing, leading to lower oxygen saturation levels during sleep. Seniors are more susceptible to this due to age-related weakening of lung capacity, posture changes like kyphosis, and even medication side effects that suppress breathing. Night after night, sleeping face down with reduced oxygen adds microscopic damage to brain tissues, damage that you won't notice until something major, like a stroke, occurs. But perhaps the most overlooked danger of stomach sleeping is its relationship to blood pressure instability. As you lie face down, the weight of your body presses against the major arteries in your chest and abdomen. This added pressure increases resistance in the circulatory system, often keeping blood pressure elevated when it should naturally drop at night. And as we discussed earlier, that nighttime drop in blood pressure, called nocturnal dipping, is one of your brain's built-in protective systems. Without it, your risk of stroke rises significantly. Imagine your blood vessels as delicate pipes. They're designed to handle a certain amount of pressure, but not constantly high pressure. Over time, this pressure can weaken the vessel walls, especially in the brain. A weakened vessel is far more likely to rupture or become blocked, leading to hemorrhagic or ischemic stroke. All of this from something as simple as sleeping face down. Unfortunately, many people don't even realize they sleep on their stomach. Some may fall asleep on their side or back, only to roll over during the night. Others may use too soft mattresses or pillows that encourage the body to tilt forward. This is why it's important not only to change your sleep position, but to set up your entire sleeping environment to support safer posture. Stomach sleeping may feel familiar, even comforting. But in reality, it's a silent threat, especially for the aging brain. It compresses arteries, disrupts breathing, interferes with circulation, and undermines all the processes your body relies on for brain health during sleep. For seniors, every night spent in this position is a gamble with serious consequences. The good news is that you can change it. You're not stuck with your sleep habits. With a few simple adjustments, and some patience, you can retrain your body to rest in a healthier way. And that's exactly what we'll cover next. If stomach sleeping is a hidden danger for the brain, then the obvious question becomes, what is the safest way to sleep, especially for those over 60? The answer lies in choosing positions that support proper blood flow to the brain, maintain open airways, and reduce pressure on the neck and spine. The right sleeping position isn't just about comfort, it's about protecting your brain's access to oxygen and circulation for 6 to 8 hours every night. Sleep scientists and neurologists agree, side sleeping, particularly on the left side, offers the most benefits for seniors concerned about stroke, heart health, and circulation. When you sleep on your left side, gravity helps drain waste products from the brain through a specialized system called the glymphatic system. This system, discovered only in the past decade, acts like the brain's cleaning crew, flushing out toxins that build up during the day, including beta-amyloid, which is linked to Alzheimer's disease. Sleeping on the left side also reduces pressure on the heart and improves lymphatic drainage. For seniors with high blood pressure or atrial fibrillation, this means less stress on the cardiovascular system during sleep. It also prevents compression of the inferior vena cava, a major vein responsible for returning blood to the heart. When this vein is blocked or compressed, circulation slows, and the risk of clot formation increases. Left side sleeping keeps that blood flow moving freely. Another benefit of side sleeping, especially for people who suffer from sleep apnea or snoring, is that it reduces the likelihood of airway obstruction. When you're on your back or stomach, gravity causes the tongue and soft tissues to fall backward or forward into the airway. On your side, that risk is minimized, and oxygen levels remain more stable throughout the night. Now, while the left side offers several specific advantages, sleeping on the right side is also far safer than sleeping on your stomach. It can still support spinal alignment, promote deep breathing, and reduce acid reflux. For people with certain heart conditions, such as congestive heart failure, the right side might even feel more comfortable. The key is to find the side that allows the neck and back to remain neutral, no twisting, no compressing, and for the airways to stay open. To adopt a side sleeping habit, seniors often need to make some practical changes. First, choose a supportive pillow that keeps your head in line with your spine, not too high, not too flat. A contoured memory foam pillow can help cradle the head and prevent the neck from twisting. This is essential because poor neck alignment can still put pressure on the vertebral arteries, even in side sleeping positions. Next, consider placing a pillow between your knees. This small change can align the hips and pelvis, reducing strain on the lower back and keeping your spine in a natural position. For people with arthritis or sciatica, this simple trick can also reduce nighttime pain and improve sleep depth, both of which contribute to better brain health. For seniors who struggle with rolling onto their back or stomach during the night, there's an easy solution. Use a body pillow or a firm pillow behind the back to prevent rolling. You can also sew a tennis ball into the back of your pajamas, a classic trick used to train the body to avoid back or stomach sleeping. These physical reminders gently keep you on your side until your body adapts to the new habit. While side sleeping offers many benefits, back sleeping also has its place, if done correctly. For certain individuals, especially those with spinal conditions or acid reflux, sleeping on the back with the head slightly elevated can be helpful. However, this position must be approached with caution. The head should be supported in a way that doesn't push the chin toward the chest or tilt the neck backward. A wedge pillow or an adjustable bed that lifts the upper body slightly can help keep the airway open while maintaining a neutral spine. What's critical to understand is that posture during sleep isn't just about bones and muscles. It directly impacts how your brain receives oxygen, how your heart pumps blood, and how your body clears waste. These processes are vital to reducing stroke risk, especially as age makes the body more vulnerable to small disruptions in these systems. Some seniors worry that changing sleep positions will interrupt their rest or cause discomfort. But the truth is, your body can adapt, especially if you give it support. Start by changing one small thing. Switch the side of the bed you sleep on so turning onto your left side becomes more natural. Adjust your pillow. Experiment with knee or back supports. Within a few nights, your body will begin to associate side sleeping with relaxation and safety. Another point to consider is the mattress itself. A mattress that is too soft may cause the body to sink unevenly, leading to misalignment and pressure points. On the other hand, a mattress that is too firm can cause stiffness and discomfort, especially in joints that are already sensitive. Ideally, seniors should sleep on a medium-firm mattress that provides both support and cushioning. Memory foam, hybrid, or latex mattresses are often recommended for their ability to conform to the body without allowing excessive sagging. Good sleep posture is also affected by what happens before bed. Avoid heavy meals, alcohol, or caffeine in the evening, as these can worsen breathing issues and trigger nighttime awakenings. Create a bedtime routine that allows the body to relax, dim the lights, reduce screen exposure, and take deep breaths or meditate for a few minutes. These steps calm the nervous system and make it easier to fall asleep in the correct position and stay there through the night. Lastly, for those with specific neurological or cardiovascular conditions, speak with your doctor about sleep positioning. In some cases, positional therapy combined with CPAP, for sleep apnea, or medications may be recommended to prevent strokes and maintain optimal oxygen levels during the night. The science is clear: the way you sleep shapes your health, especially the health of your brain. For seniors, the stakes are high. A single poor decision repeated night after night can slowly lead to catastrophe. But the opposite is also true. A single smart decision, like switching to side sleeping, can protect your brain, improve circulation, reduce stroke risk, and extend your quality of life. Sleep should be a time of healing, not harm. And by simply choosing the right position, you give your brain the best possible chance to repair, restore, and thrive well into your golden years. That's a powerful shift, and it starts with something as easy as how you lie down tonight. Sometimes, your body sends subtle warnings during sleep, signals that something may be going wrong inside, long before a full-blown stroke occurs. These signs often go unnoticed or are brushed off as normal aging, but for a brain doctor, they are red flags. Recognizing them can be the difference between early prevention and a medical emergency. One of the most overlooked warning signs is sudden snoring or choking sounds during sleep, especially if it's a new development. While many people snore occasionally, loud, irregular snoring with gasps, snorts, or periods of silence may point to sleep apnea. Sleep apnea temporarily halts breathing during sleep, reducing oxygen to the brain. Over time, these repeated episodes can lead to high blood pressure, irregular heartbeat, and yes, even strokes. Seniors who sleep on their back or stomach are more likely to experience these episodes because gravity allows soft tissues to collapse into the airway. Another sign to look for is frequent nighttime waking or restlessness. Many older adults assume waking up several times a night is just a part of aging. But when sleep is fragmented, especially if you don't feel refreshed in the morning, it could be a sign that your brain isn't getting enough oxygen during the night. Poor sleep quality can also elevate cortisol, the stress hormone, which in turn narrows blood vessels and raises stroke risk. Pay attention to early morning headaches. These can occur when there's increased pressure in the skull or prolonged periods of low oxygen overnight, both of which are linked to sleep apnea and poor sleeping posture. A headache that disappears a few hours after waking is your body's way of saying something was off during the night. Tingling or numbness in the arms or legs during sleep can also be a concern. While this may be caused by pinched nerves or arthritis, it could also indicate restricted circulation, particularly if you're sleeping in a position that compresses blood vessels or nerves for extended periods. This numbness may seem harmless at first, but it may be a clue that blood isn't flowing efficiently, increasing the chance of clot formation. Nighttime confusion, agitation, or sudden changes in behavior, especially in seniors with mild cognitive decline, can also be tied to poor oxygenation or mini-strokes. Known as transient ischemic attacks, TIAs, these mini-strokes often occur during sleep and may not cause lasting damage. But they serve as serious warnings of an impending major stroke. Another commonly ignored symptom is excessive sweating during sleep, particularly around the neck and head. While it might be blamed on room temperature or hormonal shifts, in some cases, it reflects autonomic nervous system distress, especially during episodes of oxygen deprivation. The brain may trigger a sweat response in an attempt to regulate internal temperature or stress levels due to reduced circulation. Seniors should also note abnormal heart rhythms during sleep, which may manifest as waking up with a racing heart, skipping beats, or unexplained anxiety. Atrial fibrillation, an irregular heartbeat, is a major risk factor for stroke and can be triggered or worsened by poor sleep posture. Lying in positions that compress the chest or increase neck pressure can disturb heart rhythm and elevate stroke risk overnight. Equally important are changes in vision, speech, or coordination that appear upon waking. If someone wakes up and feels dizzy, has blurry vision, slurred speech, or weakness in an arm or leg, it may be a sign that a silent stroke occurred during the night. These wake-up strokes are especially dangerous because they often go unnoticed until the damage is done. The sleeping position and quality of oxygen delivery overnight play a big role in such events. Sometimes, the warning signs are not experienced by the sleeper, but by their spouse or caregiver. If your partner notices that you stop breathing at night, make choking sounds, or seem confused or disoriented in the morning, take it seriously. These signs should never be dismissed as simple snoring or bad dreams. They could be your brain's last early warning before a crisis. It's also worth mentioning that nighttime bathroom trips, while common in seniors, can sometimes be a reflection of interrupted sleep cycles caused by poor circulation or oxygen deprivation. Frequent urination at night, nocturia, may be connected to underlying issues that are also increasing stroke risk. One of the most critical factors to remember is that sleep should be restorative. If you're waking up groggy, dizzy, unbalanced, or feeling like your brain is in a fog, that's a sign something's wrong. The goal of sleep is not just quantity, it's quality. If the brain isn't getting enough oxygen, nutrients, or time to repair, it begins to falter, leaving it vulnerable to stroke and other age-related diseases. If any of these signs are present, don't panic, but don't ignore them either. First, evaluate your sleep posture. Are you sleeping on your stomach or back? Do you use the right pillow to support your neck? Do you often wake up with your head tilted forward or compressed against your chest? These little details matter more than you think. Next, talk to your healthcare provider about undergoing a sleep study. These tests monitor oxygen levels, brain activity, and breathing patterns throughout the night. They can reveal underlying problems like sleep apnea or irregular breathing that may be silently increasing your risk. You might also need a simple ultrasound test of your neck arteries, called a carotid ultrasound, to check for narrowing or blockages that could trigger a stroke while you sleep. Changing sleep posture is one of the easiest and most effective interventions for seniors. Unlike medication, there are no side effects. Unlike surgery, there's no recovery time. And unlike complicated therapies, it doesn't require special training or equipment. All it takes is awareness, intention, and some simple tools like the right mattress, supportive pillows, and positional aids. The idea is to catch danger early, before symptoms escalate. The human body often whispers before it screams. The signs that your brain is under stress don't always come as pain or a major episode. They come as patterns: poor sleep, fatigue, morning fog, odd sensations in your limbs, or even changes in mood and memory. Ignoring these patterns is like ignoring the tremors before a quake. But tuning in, listening, and taking small, consistent action, like changing your sleep posture, can dramatically lower your risk. You may not be able to control everything that happens in your body, especially as you age. But the way you sleep, that's entirely in your hands. Understanding these nighttime warning signs doesn't mean you live in fear. It means you live informed. It means you sleep smarter, and you give your brain the care it deserves. After all, your brain works hard for you every day. The least we can do is protect it every night. Now that you've seen the science, the warning signs, and the dangerous sleep habits that many seniors fall into unknowingly, it's time to take action. Knowledge without action is just information. But knowledge applied? That's prevention. That's empowerment. That's how we stay one step ahead of devastating health events like stroke. You don't need to be a brain doctor to make a difference in your own brain health. The choices you make tonight, how you position your head, your neck, your back, your pillow, can have a profound effect on how well your brain functions tomorrow. And the day after that. And every day to come. It's easy to dismiss sleep posture as something small or unimportant, but when you're over 60, there are no small details. Every decision matters more. The blood vessels that keep your brain alive, the oxygen that fuels your thoughts and memory, and the nerve signals that keep you moving, they all depend on the quality of rest you get. And that quality starts with how you sleep. If you've been sleeping on your back or stomach for years, you might feel resistant to change. That's normal. But think of it this way: if a simple adjustment in your sleeping position could reduce your risk of a life-altering stroke, wouldn't it be worth trying? Even a small shift, like using a side sleeping support pillow or adjusting your neck alignment, can mean better circulation, deeper sleep, and a stronger brain. More than anything, I hope this video empowers you to take control of your sleep. Because protecting your brain isn't about one big change, it's about consistent, conscious care. One night at a time. If this video helped you, or if you know someone over 60 who struggles with sleep or worries about their health, please share this with them. It might just save a life. Make sure to subscribe for more brain-protecting, life-enhancing health insights, straight from the source. Your brain deserves it. Your future depends on it. And together, we can make sure every senior sleeps smarter, starting tonight.